In 2026, the myth that bigger is better for healthcare is being debunked. While megacities like New York or Los Angeles boast world-renowned research hospitals, the average resident often faces month-long wait times, congested emergency rooms, and a low doctor-to-patient ratio. The most efficient healthcare in America is currently found in medical powerhouse mid-sized cities. These locations offer the same level of specialized equipment and elite talent as major metros but with significantly higher per capita access and lower administrative friction. 1. Rochester, Minnesota. Why number 1, Rochester is the undisputed world capital of healthcare efficiency. Home to the flagship Mayo Clinic, the city is essentially built around a medical ecosystem that outpaces any major metro. In 2026, Rochester has the highest density of specialists per capita in the United States. The access edge, because the Mayo Clinic is the city's primary employer, the entire infrastructure, from hotels to transit, is optimized for patient care. The difference, in a major metro, you might wait 3 months for a neurology consult. In Rochester, the integrated Shield system often coordinates multiple specialist visits and labs within a 48-hour window. 2. Ann Arbor, Michigan. Why number 2? Driven by the University of Michigan health system, Ann Arbor offers a level of academic medical expertise that rivals Boston or Chicago but without the 6-hour ER waits. It is a healthcare sanctuary, where the doctor-to-resident ratio is among the highest in the Midwest. The specialty factor, in 2026, Ann Arbor leads the nation in per capita access to pediatric and oncology subspecialists. The difference, the city's smaller footprint allows for a highly connected community health network, meaning your primary care physician and surgeon are often on the same digital and physical campus. 3. Madison, Wisconsin. Why number 3, Madison consistently ranks as one of the healthiest cities in the U.S. due to its high-volume, low-friction healthcare model. Anchored by UW Health, it provides residents with a medical safety net that is statistically more accessible than those in nearby Chicago or Milwaukee. The insurance edge. Madison has a highly competitive local insurance market that prioritizes preventative care, leading to the lowest rates of preventable hospitalizations in the country. The difference, Madison's urban design integrates wellness and clinical access, with neighborhood clinics placed strategically to ensure no resident is more than 10 minutes from a primary care provider. 4. Charlottesville, Virginia. Why number 4? For a town of its size, Charlottesville punches 10 times above its weight class. Home to the UVA Medical Center, it offers Level 1 trauma care and advanced clinical trials that are typically only found in cities with populations over 1 million. The research advantage. In 2026, Charlottesville residents have unprecedented access to experimental treatments for rare diseases and advanced cardiology. The difference. It offers the prestige of a Tier 1 research university with a small-town patient experience, where the administrative burden is significantly lighter than in the DC or Richmond metros. 5. Durham, North Carolina. Why number 5? Known as the City of Medicine, Durham is home to Duke University Health System. In 2026, the city has more medical professionals per square mile than almost any other location in the South, earning it a spot over high-density metros like Atlanta. The Innovation Corridor. The city is a global hub for biotech and clinical research, meaning residents are often the first to access new medical technologies. The difference. Durham's medical infrastructure is so vast that it serves as a regional magnet, yet local residents enjoy priority scheduling through integrated community portals. 6. Iowa City, Iowa. Why number 6? Iowa City is a medical oasis in the heart of the Midwest. The University of Iowa hospitals and clinics provides a massive volume of specialized care that far exceeds the needs of its local population, resulting in excess capacity and rapid appointment availability. The capacity bonus. Unlike major metros where hospitals operate at 95% plus capacity, Iowa City's facilities are designed to handle the entire state's most complex cases, giving locals a fast pass to elite care. The difference. It is one of the few places in 2026 where you can see a top-tier academic specialist for a routine issue without a multi-week referral process. 7. Burlington, Vermont. Why number 7? Burlington offers the best, personalized healthcare in the Northeast. With the University of Vermont Medical Center serving as the anchor, the city has a unique, single-system advantage that ensures your medical records are never lost in a bureaucratic shuffle. The continuity factor. In 2026, Burlington leads in continuity of care metrics. Patients here are more likely to see the same provider for decades compared to the transient medical markets of NYC or Philly. The difference. The focus is on holistic and rural integrated health, making it a top destination for those who want high-tech care without the assembly line feeling of big city hospitals. 8. Salt Lake City, Utah. Why number 8? Salt Lake City is the headquarters for Intermountain Health, one of the most efficient and data-driven healthcare systems in the world. In 2026, it outperforms major West Coast metros like San Francisco in terms of surgical outcomes and affordability. The value leader, Intermountain's integrated delivery model keeps costs low and quality high, making Salt Lake City a national leader in healthcare value. The difference: the city utilizes a digital-first triage system that identifies health issues through wearables before they become emergencies, a level of tech integration rarely seen in larger, older metros. 9. Gainesville, Florida. Why number 9? While Miami and Tampa struggle with retiree overload, Gainesville offers a streamlined medical experience anchored by UF Health Shands. In 2026, it is Florida's premier destination for neurology and cancer care with significantly shorter wait times than South Florida. The academic anchor: as a major college town, Gainesville attracts elite young medical talent who stay for the research opportunities, creating a high-density pool of specialized doctors. The difference: Gainesville's medical district is walkable and highly concentrated, allowing for multidisciplinary consultations to happen in a single afternoon rather than across a sprawling city. Conclusion: the access over size strategy. In 2026, the best healthcare is no longer found in the tallest buildings, but in the most integrated ecosystems. These 9 cities prove that access, defined as the ability to see a specialist quickly and affordably, is the true metric of a healthy city. While major metros may have the best single doctor, these cities have the best systems. Choosing a city like Rochester or Durham is a strategic move for your longevity. You are essentially trading the chaos of the big city for a direct line to excellence. As the U.S. population ages and the doctor shortage worsens, living in a medical magnet town is becoming the ultimate insurance policy. As we move through 2026, the traditional hierarchy of American cities is being dismantled by a simple, powerful metric: functional access. For decades, the major metro was the only destination for elite careers, high-growth real estate, and specialized healthcare. Today, the data reveals a scaling penalty in these giants. The friction of high costs, administrative bloat, and sheer population density has turned the once coveted coastal hubs into high-resistance zones. The why behind the rise of mid-sized powerhouses like Rochester, Madison, and Durham is rooted in their ability to offer Tier 1 results with Tier 2 friction. Whether it is a house that appreciates at 13% or a specialist appointment available in 48 hours, these cities have optimized their infrastructure for the resident, not just the corporation. We are witnessing a geographic rebalancing where the middle of the country is no longer a flyover zone but a sanctuary for quality of life. Ultimately, the 2026 American landscape is defined by agency. With the rise of remote work and the decentralization of healthcare, you are no longer a prisoner of your geography. You have the power to arbitrage your life, moving your capital and your health to the locations that value them most. The future of America isn't just happening in a few select skyscrapers, it's happening in the vibrant, efficient, and accessible cities that are finally getting the attention they deserve.